Good afternoon. I hope everyone's doing well and staying healthy during this current COVID-19 situation. I want to thank all of you caregivers and those supporting the long-term care community with everything that you're doing out there for your residents and within your communities. It's means a lot to us, and we recognize that you are just doing wonderful work as always, but above and beyond. So thank you for everything that you're doing, and thank you for taking time out for today's webinar. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a couple of housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for 1 continuing education credit for PHCA members. Credits will be uploaded to the NAB site within the next 2 weeks for those of you who have provided us with your unique NAB number. I'll be sending a quick link to a survey. Your feedback is important to us and to our speakers, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane on the right hand of your screen, and our presenters will address them at the end of the presentation today. Today's webinar is being presented by Terry Freed, Chief Technology Officer with Prelude Services, and Deb Larkin, the Corporate Director of Compliance and Privacy Officer with Presbyterian Senior Living. Terry and Deb will be presenting cybersecurity best practices in long-term care. They will be providing guidance to help you in keeping your communities in compliance and avoiding risk. I'll now turn the webinar over to Terry and Deb.
Thank you, Wendy. Hi, everyone. My name is Deb Larkin. As Wendy said, I've been working in senior living since the early 1990s, and the bulk of my career has been spent as a nursing home administrator and executive director. I've worked with Presbyterian Senior Living for the past 14 years, and in 2019, Presbyterian Senior Living shifted my operational gears, moved me into a full-time compliance and privacy position. In 2019 as well, I became certified in healthcare compliance. So I am still relatively new to all things cybersecurity, and as a result, what you will likely hear from me today is very black and white, and that tends to sound rather ironic given my position. Terry, did you want to introduce yourself?
I sure would. Thank you, Deb. My name is Terry Freed, and as Wendy mentioned, I'm the Chief Technology Officer for Prelude Services. Prelude is a managed service organization focusing on long-term care. I've been working in healthcare IT for over 30 years, primarily focused on the technical side of it. So this would be everything from the desktops to data center to cybersecurity. And I appreciate the opportunity to speak with you all today. I will turn it back over to Deb.
All right. Terry, you can move to the next slide. Thank you. So today we are hoping to give you suggestions and ideas as it relates to securing your organization's HIPAA IT assets. You will hear Terry and I interchange some terms like HIPAA IT and Electronic Protected Health Information, or ePHI. We will try to be cognizant of our terms and not use too many abbreviations as we're talking. Terry and I are going to be talking about risk and vulnerabilities that exist for covered entities and business associates, which our organizations all are. There are things that you can and should do internally, and there are things that you can and should be doing externally to protect your electronic PHI. With the growing number of attacks and data breaches, especially in our industry, it is imperative that we remain focused on these threats and invest appropriately into our cybersecurity defenses. This issue is only escalating with the COVID emergency that's been occurring. We hope you leave this discussion today with an understanding of HIPAA security and able to assess, identify, and use tools to secure electronic protected health information. Terry, could you go to the next? So let's get started by touching on why this is such an important topic to safeguard electronic ePHI. Our risks continue to increase. Between 2009 and 2017, reports of breaches of unsecured PHI affecting 500 or more individuals were most commonly related to theft, loss, unauthorized access and disclosures, IT incidents, and hacking. Today, breaches of unsecured protected health information affect more than 41 million individuals. Hacking is up by 49%, and now it affects the greatest number of individuals with breaches. Cybersecurity attacks against healthcare organizations are also up 125% compared to 5 years ago. The average consolidated total cost of a data breach has reached $3.8 million. So maintaining the security of PHI is a matter of resident safety, not just regulatory compliance. Next. Today, we can't really stress enough of why cybersecurity and protecting ePHI should be something on every organization's radar. This article is one more reason everyone should be looking at their security practices. Health and Human Services announced in January of this year a 5-year focus on improving and developing more standards, focusing on privacy and security of protected health information. This article is about how the Office of the National Coordinator has established this strategy for Health and Human Services. The Office of Civil Rights is responsible for enforcing this for Health and Human Services, and the Office of Civil Rights has already been conducting compliance reviews, random audits, and investigating complaints. Since December of 2018, approximately 136 Office of Civil Rights cases have been referred to the Department of Justice for criminal investigation. What this tells us is that we should anticipate more enforcement with this new Health and Human Services focus. Next. So our first objective for this discussion is to understand how to meet Health and Human Service requirements for HIPAA IT security. With the growing number of attacks and data breaches, it's imperative that organizations remain, number one, focused on threats, and number two, invest appropriately in cybersecurity defenses. The question for us is really, where should we be looking to find guidance on this? Well, I look to the HIPAA Security Standards Final Rule. This is referred to as the security rule, and it addresses HIPAA IT security and the protection of ePHI. The security rule has been around for a while. It was issued by Health and Human Services in 2003, and it established standards protecting ePHI created, used, and maintained by a covered entity and a business associate. All this means is that covered entities and our business associates are required to secure electronic protected health information. How we do this is by following the 3 required safeguards in the security rule. The safeguards are the administrative, technical, and physical. The role of those safeguards is to protect ePHI that's created, maintained, and/or transmitted. Through the safeguards, we can ensure confidentiality, integrity, and security of our ePHI. It is important to recall the security rule was created to be complementary guidance for the privacy rule. So essentially, we can think of the security rule guidance as a roadmap to operationalizing the privacy rule. Covered entities were required to comply with the security rule in 2005, and business associates were given until 2013 to comply. So if we haven't been addressing cybersecurity yet, we need to be. Next. So let's talk about the common roadmap or the work plan structure that many of us already use for different things, and use it as a guide for us through meeting the 3 security rule safeguards. This is how we can identify and begin to manage our risks and vulnerabilities. So begin at the top of the red circle. Number 1, identify that your organization has risks and vulnerabilities with regards to security, confidentiality, integrity, and availability of ePHI, and begin completing a risk analysis. What this means is we should look at our policies and procedures to ensure ePHI security risks are being addressed and what might be missing. Working clockwise, step 2, the green circle, is where we want to ensure somebody has been designated within the organization and externally to be responsible for security. Internally, this individual would be responsible for developing and implementing HIPAA security policies and procedures. Externally, this is when an IT entity like Prelude that provides the broader technology support could come in. Components of the work plan developed needs to be addressed externally as well as internally. Step 3, the purple circle, that's when we determine internal and external controls that meet the security rules standards. This may mean, with regards to employee security, who does or does not have access to ePHI, or with regards to information access, how access is authorized and restricted. Looking at preventative measures and procedures in place for detecting and dealing with or containing or mitigating a violation, and developing a contingency plan to deal with the unexpected situation that would jeopardize the security of ePHI. Step 4 is the blue circle, and that's when we prioritize and begin to implement an action plan. Terry, you skipped ahead. There we go. So
Sorry
the blue
about that.
circle. That's okay. So this should include employee training. In step 5, the orange circle, we assess and monitor the effectiveness of the action plan implemented. This step is about implementing new solutions when gaps are identified, eliminate the risk. And finally, with step 6, we reevaluate and update steps 1 through 5 as necessary. That's when we start all over again. These plans need to demonstrate that they are being monitored and evaluated periodically. And we need to make sure we can show documentation of that effort and that it includes our analysis. There's no set timeline for how long this process, 1 through 6, needs to take. It's a timeline that's unique to every organization. Next. So let's talk for a moment about how we complete a risk assessment. This is the step 1 of the roadmap. We look at the threats to security of our ePHI, and we measure what may be needed to protect against those threats. A threat is a potential disclosure of ePHI, and this is also when we begin to identify how we manage risks and vulnerabilities of the HIPAA IT security. Use the expertise of your external IT entity to support in this risk assessment step. Risk assessment should consider the size and complexity and capabilities of your organization, your organization's technical infrastructure, which would include hardware, software, security capabilities, and the probability and criticality of potential risk to your ePHI, and the cost measures, of course, of those security, the cost of those security measures. I would recommend using a security risk assessment tool that's been provided by Health and Human Services. I have the link on this slide. Health and Human Services updated the version of the security risk tool recently, and when completing ours, our IT provider completed the tool side by side with us, which helped us ensure that we had addressed internally and externally each component. NIST also has a crosswalk that can assist in the risk assessment process. Next. So step 2 is where you designate a responsible person internally and externally. I'm going to spend more time on steps 3, 4, and 5 of the roadmap. These are our action steps where we determine our controls, prioritize and implement an action plan, and assess and monitor effectiveness. We're facing a lot of IT security risks, and they seem to be growing and or evolving by the day. And we know that how we manage our HIPAA IT security risk is critical. The 3 safeguards, in some respects, identify for us established best practices. So this is why you'll hear me leaning hard on these 3 security rule safeguards to guide us through steps 3, 4, and 5 of the roadmap steps. The administrative safeguards make up more than half of the HIPAA security requirements. This safeguard component is about establishing policies and procedures protecting ePHI. So this would be like who has access, what type of access do they have, and what can they and can't they do with their access. And we need not only to implement, but we need to maintain security measures around access through proactive and routine self-auditing. Next. This is an example of one of our on-site and off-site self-audits that I complete annually or upon identified need. I know you can't read the small print, but I wanted to show you that things like this do exist. Next. And last, under the administrative safeguard, we need to communicate our expectations of employee behavior in relation to protection of ePHI. We can create employee awareness through training in communication or risk. With physical safeguards, think of our touchable property. This is quite literally our physical equipment. So physical safeguards involve establishing policies and procedures on how equipment is replaced, how it's accessed, access to the electronic devices or equipment, how we manage third-party providers who access our equipment. Yesterday, I read an article on how 66% of reported security breaches were the result of theft of healthcare devices. This, fortunately, has not been my experience. However, with increased use of emails, laptops, smartphones, the risk exists to our communication arena, and our policies and procedures are obviously critical. And any access to electronic devices and equipment really should be authorized. We should regularly be auditing our equipment and our devices. We need to know where they are. The things that hold our ePHI must be protected from unauthorized access. So this means those locations where we keep desktops or laptops, smartphones, and tablets. Look at how you're protecting or restricting access to those devices, and how do we control the receipt of the devices, the removal or movement of any of the hardware or electronics that hold our ePHI into out of or within our communities. Think about our current challenge with COVID. Some of our staff are working remotely. And what equipment were they given to work remotely? Was the equipment logged? When it comes to IT tools and solutions and the technical safeguards, this is where I begin my segue for Terry. The technical safeguards relate to our network and our system security and are about establishing policies and procedures, again, for the use of technology systems and networks we use that in order to protect our ePHI. Think about aspects of the network computers and devices that communicate with each other that contain ePHI in those transmissions. How do we control or limit things to our network or our electronic health record systems? Is there an audit control system that monitors the activity to these networks? Or how is our firewall monitored? How do we protect integrity of the ePHI from being improperly altered or destroyed? Do we have an authentication process that verifies who is accessing the electronic system? And last but not least, how do we transmit information ensuring authorized access to the information? Terry, I think this begins to set you up to talk about the technical facets of IT security and the considerations of cybersecurity and IT tools.
Yep, sure does, Deb. Thank you very much. So for the second half of the presentation today, I'm going to focus really, as Deb mentioned, on the techniques and tools that we can employ to do all of these things that Deb's been talking about, right? So we know why we have to do it. And what I'm going to try to answer for you is why is it so difficult to do this? And really, the slide you see in front of you, it all boils down to a couple things. Today's world of IT computing is much faster, it's more complex, it's less forgiving, and it's everywhere. And those are all ingredients for a recipe for disaster. While your computer runs faster on your desk than it did, 10 years ago, and you can do much more on it, and you can do it from anywhere, from mobility, the attackers of the world are enjoying those same benefits. Things are online all of the time. The hackers have access to tools to exploit things with sharing over the internet. Software is much more complex these days, so it takes a while for people to find vulnerabilities, which means delays in patching. And then lastly, it's really difficult, I think, for the average computer user to know what they need to do to keep their device secure. So in terms of managing vulnerabilities from the technology standpoint, what I'm going to highlight are some defenses. And these defenses are best implemented when they are done as a layer. And that layer is going to go from the user the whole way out to where they touch the internet and the public network. I'm going to group these into two categories. The first is user vulnerabilities. And these are things that you can directly influence by working with staff and controlling with process and procedure. There are software tools and technologies, but this is really managing the weak link of your cybersecurity chain, which is the end user. And then we'll talk about some security technologies that you can put on top of that. So we'll talk about the most important defense, which is the user. People being people and being human, mistakes are made. And unfortunately, we've not given them the protection or the education or the tools to keep themselves secure. If you see the graphic at the bottom of the screen, this was a screenshot from before a Super Bowl. And they were highlighting that this was the first of its kind security center, big command center for security. And this was broadcast over the air. And you can see over on the left side, one of the screens had their Wi-Fi password and network information live for millions of people to see on television. So again, the technology didn't fail, but it was the people that failed and just weren't cognizant of what they needed to do. So starting off with why the user is a key defense is because our users authenticate against the IT systems as part of their job. And when we say authenticate, we mean they sign on to systems, right? So they're using Matrix Care, they're using Point Click Care, they're using whatever IT systems are running your organization, whether they're clinical or they're administrative, like, email or just using the web. So they interact with these systems in a couple different ways. And I'm going to step through the big three, which are what you know, what you have, and what you are. You're probably most familiar with the what you know approach, which are passwords. Some of you may have experience with the what you have, which is multi-factor authentication, and then the what you are is biometrics. So I'm going to step down through those briefly. When we talk about what you know, which is passwords are primarily the way that we authenticate with systems. And even outside of your work, you use passwords to get into social media. You use passwords to get into your online shopping. The whole world is run on you remembering a password. And the problem is that the human brain has trouble remembering big numbers or big strings of characters or lots of complexity, right? So we get into some really bad habits with our users and passwords. We tell them that their password needs to be complex, and that means it has to have, special characters and numbers and capitalization. So again, that makes it tough for them to remember. So sometimes they write things down, but what they also do is they reuse their passwords. And what that means is that if they're going to create and remember this really great password, they're very inclined to reuse that on other websites, whether it's banking or personal social media. I've seen a lot of statistics about the number of passwords people have, but the average user likely has around 6 unique passwords that they use to manage the 25 to 100 systems that they have out there. So the risk in that is that once one system gets exploited, it's very easy to exploit other systems that user had access to. Adding on top of that is IT always likes to expire your passwords in case they get compromised. So in some routine, process, whether it's every 60 days or 90 days or whatever, these users are being asked to come up with something again. So there are some solutions for it. And the first solution is a passphrase. So I can tell you right now that the industry pretty much considers the 8-character password as being dead. And when we say dead, we mean that a lot of organizations are relying on this best practice from years ago, which is strong password of 8 characters. And what has happened today is that modern computers can crack that password in seconds. So it doesn't matter if your password is not even an English word. It doesn't matter if it's something that no one would ever guess. The bottom line is that with 8 characters, there are only so many combinations available to make that unique, and hackers can crack that very easily. So passphrases are a way of extending that out to 15 characters. And you might think, well, how am I going to remember 15 characters? A passphrase is what it sounds like. It's a phrase that you can remember. It can be a portion of a sentence. It can be a phrase, right? So the longer your password, the harder it is for people to crack. There are password managers, which are tools that you can buy and store all of your passwords in them. And you protect that password store with a really, really strong password. But then you can use that tool to sign you on to different systems. The message, though, with passwords is that eventually computing is going to catch up, and your 15-character password that was strong today will not be strong tomorrow because computers will get faster. So this leads into the next recommendation, which is adding multi-factor authentication, which is the what you have. People have been talking about the death of the password forever. And right now, you're probably seeing a lot of multi-factor authentication. You're seeing tokens from companies like RSA. You're seeing smart cards in the military. And then you're also seeing apps like Duo. Maybe your banking site requires that they send you to your phone maybe a couple characters that you have to key back into the website. Maybe Google or Yahoo or your email provider do that. So the idea behind what you have is that you just assume that your password is going to get compromised someday. But this is a second factor of authentication, which means I have something and no one has stolen that from me. That thing can be a phone, it can be an email account, or it can be a little gadget like you see on the left. So definitely recommend multi-factor authentication, especially for remote access. And of course, I think the world thinks that the best approach for authentication is biometrics, which is using physical characteristics. This is, it started off like 20 years ago with fingerprint readers, and that was all high tech. You would see it in Mission Impossible, and then it was retinal scanning, and then recently you've seen it with a lot of our phones, right? You have Face ID with the iPhones. Prior to that, Apple was big on the fingerprint readers. So again, these are better than passwords. They're better even than multi-factor authentication because there's nothing to steal because it's your person. Okay, so that's the second or the first user vulnerability that we'll talk about. The second is going to be phishing risks. So email, everybody still uses email, even though we've kind of segued into Twitter and texting and IM. Email is still a big way for companies to communicate. And the hackers know this, and that's why email continues to be their primary way to attack companies. If you look at the chart here, January of 2020, it shows the number of records that have been breached, and it's categorized by how they breached it. And you can see email, by and far the largest attack vector for getting data out of your system. And phishing is this notion of somebody malicious who is sending you an email to get you to click on a link, to open an attachment, to provide your credentials, and they're very successful with this. They send out millions of phishing emails, and really they only need one or two people to click on something for them to get what they need. So your users, even with a really strong email firewall, they're probably still seeing a lot of phishing going on in their space. So your organization should have some best practices in place, like user education. You should be warning your staff when particularly bad phishing email is received, reminding people of best practices. It can be part of your annual CBLs for training. There are tools as well that will actually test your employees. And a lot of these tools come with a button that you can attach to Outlook, and you can, when I say you, it might be your IT organization, it might be your compliance group, but you can craft what are in effect fake phishing emails, and you can target your employees. And a lot of these tools will tell you who clicked on it, when they clicked on it. People that do click on it, it gives them some education. And the goal really isn't punitive. It's not to say, oh, well, you failed this and we're going to put you on written warning. The idea is this education piece. You keep doing it until people immediately recognizing phishing whenever it occurs. The third user vulnerability we're going to talk about is all of their access to data and what they're doing with it. There are all kinds of vulnerabilities with data, no matter where it sits. You probably have people that are storing data out in Dropbox, right? So that's a risk, because when they leave your organization, you terminate their network access, their EMR access, but you probably are not terminating their Dropbox access because you are not aware of it. So it's good to get your arms around that, and there are some best practices for that. USB drives. USB drives have been the bane of existence for compliance for years. If you're using them, they need to be encrypted. A best practice is to have your devices configured to only write to encrypted USB drives. Reading from them might be okay, but you need to have some controls in place to keep data from leaving your system, which goes under the category of data loss prevention. Do you know when good people or bad people are taking data off of your organization, whether it's on to the next job or off to a competitor? And then lastly, when your users are out there working in data, ransomware is really, really common these days. So ransomware is when some malware is delivered, and it's usually by phishing. Sometimes it can be through a malicious website. But basically, ransomware encrypts the data that that user has access to. And when we say that, that can be not only their local drive, but their personal network drive, maybe a department share. In some cases, entire EMRs for health systems have been encrypted and held for ransom. There have been police departments, there have been whole cities. When it happens, they're left with two choices. One is to restore data, and the other is to pay the ransom. And that's pretty much rolling the dice. Palo Alto has a great quote. Palo Alto is a tech vendor. They say ransomware is not a malware problem, it's a criminal business model. So you have to have very effective tools in place with antivirus and training and good internet-facing barriers to keep ransomware out of your network. And once it gets in, again, it's a criminal business model. These criminals just want some money, and sometimes people are required to pay it. So I just focused on the user for a while. Let's just talk about some general tools that are helpful. One's a good best practice to figure out who has privileged access to your systems, whether that's IT or maybe it's a certain manager. Identify those people that have a super user access and audit that periodically and change it periodically. Another is you all have antivirus software on your computers. The world is moving to a signature-less antivirus software world. What that means is that most of the antivirus packages that are out there right now, they have a huge file that has basically the signature of every virus that they know about. And when that signature, that string of, data bytes shows up on your computer, they flag it as a virus. But the problem is that every day there are thousands of new viruses being created. So there are new antivirus packages that are more behavioral based, and that's something that you should look at. Patching, make sure your IT partner or your internal IT company is patching not only the Windows and Microsoft products, but third party, because those are great attack vectors for the bad guys. Log aggregation. There's so much equipment out there and there's so much data coming out of it that there are tools to place all of this information so that your IT staff have visibility into the entire enterprise instead of specific systems. And then lastly, next generation firewalls, the equipment that sits out between you and the internet. In the old days, again, very signature based, just looking for bad strings of data, but nowadays they're looking for bad behavior. So just to wrap up here, just a couple slides on the virus outbreak. The news is that the attackers are just delighted by this current situation. They're delighted because they've spent decades attacking these big corporate infrastructures, companies spending millions of dollars or tens of thousands on cybersecurity tools. And then suddenly they don't have to do that anymore because people have been sent home. Now all they have to do is attack a $50 Linksys router. So for them, it's a great opportunity to attack. And there's been a lot of talk in the industry. A lot of companies are worried about this this change that we've had to make in response to the virus. So a couple recommendations on how to reduce your risk of remote workforce. Make sure your staff have a password on their home Wi-Fi. Right? A lot of people don't. Make sure they've changed their default administrative accounts on their home routers. It's very easy for the attackers to, sitting on the internet, sign on to routers and be watching what they're typing in the sites they're going to. Make sure your staff are updating their home routers with new code as it comes out, very much like your computer. The routing companies, Linksys and D-Link and others that are in all of your homes, they put out updates just like everybody else, and people exploit it when you don't. And then I think, the really important thing is this separation between work and personal use. When people are working at home, they should not fall into old habits of, using their work device for personal use, not letting family members use their work device. One more slide. Protecting virtual meetings. You've probably all heard the phrase Zoom bombing. Well, that came about because Zoom has become almost the de facto tool for companies as they scrambled to offer video and collaboration. If you see the chart at the top, you can see the increasing growth from WebEx and Skype and Zoom since this outbreak occurred. And you can see it's quite substantial. The crimson-colored wave is Zoom. They've all grown, but the idea of Zoom bombing is people are trying to get into your meetings because in these meetings, people are talking about sensitive things. There's a concept called war dialing, which means that they don't need to know who you are. They don't need to know what company you work with, or if you even have a meeting. They have software that looks out into the internet, and by guessing character strings and certain things, they're able to join meetings without knowing anything about the purpose of the meeting. And they demonstrated that recently where they turned a war dialer loose on Zoom meetings, and in 1 hour, in 1 day, they found 2,400 meetings that they could get into. So the issue with that, again, is that you're having a meeting, maybe you're talking about patients, maybe it's family talking to a resident. The last thing you want is somebody eavesdropping or recording or being disruptive to that session. And there's a couple simple things to address that. The first is make sure you have a password on all of your meetings. And it's okay to share that password with the people that need to get in, but don't let it be scheduled without a password. That's how the war dialers find it. And then also update your video client. Zoom just put out a release, I think it was last week, and all of these video people are scrambling to close up loopholes that people are finding, whether it's with encryption or just basic functionality. So make sure when you see that pop-up that says, hey, Zoom has an update, allow that to happen. There was somewhat of a, I don't want to call it a gentleman's agreement, but the attackers of the world seem to imply that during this dangerous time right now that they were not going to attack healthcare because it was kind of inhumane. But their words and their deeds don't seem to match up because attacks on healthcare have increased and they're really seeing opportunity. So I hope that some of these technical defenses are things that you can take back, and I know some of them are a little technical, but talk to your IT department and ask them what are they doing to protect you with not only current but emerging threats, because it can be a very dangerous place. And that is the end of my material. Wendy, I will turn that back over to you.
Great. Thank you, Terry and Deb. That was great information that you shared today and timely. I know I've heard some of that, hacking into Zoom meetings and calls. So that's definitely happening right now in this time when we're having to rely on it. So at this time, we're going to open up the question and answer portion. So if you do have any questions, please type it in the question box on the right hand of your screen, and we'll just wait a couple minutes on that. I just want to remind you that PHCA does have lots of resources available to you on our website to help you deal with COVID-19. We have, staff here that will assist in any way, so please don't hesitate to reach out to us at any time. We are here to help, and we want to be able to assist you in any way that we can. So if anything comes up, please don't hesitate to reach out to us. We're right now, I know it's ways off, but we are planning our annual convention for later this fall, for November 10th to the 12th. Stay tuned for it. Our call for presenters will be going out hopefully later today. Those submissions are due back by the end of this month. So if you know any good speakers, or if you yourself would like to submit, check our website and just stay tuned for email correspondence on it. And we do have other upcoming webinars scheduling into May, June, July, and August. We have a leadership webinar series that was supposed to start this week, a 5-part series, but we had to postpone it under the current conditions. We know that you all are really busy and don't have a lot of extra time on your hands to sit in on those. So we appreciate everybody who logged on today. And again, we have rescheduled the leadership webinar series to start in July. So you can check our website on that, and more information will be coming to you as things cool down a little bit under COVID-19. I'm not seeing any questions. Do know that I will be following up with an email later today with a link to the presentation, and the email will have our presenters' contact information. So if you do think of anything and need to reach out to them, their contact information will be made available in the email. Just a reminder that I will be also sending a survey in addition to a recording for today's webinar. So please take a moment to complete the survey, and again, be on the lookout for more PHCA webinars. So right now, I just want to thank Terry and Deb for presenting on this topic, and I want to wish everybody a great day. Stay well and stay healthy, and keep doing what you're doing, and hopefully we'll get to the end of this and regroup and be back to normal before we know it. Thanks, everybody. Have a great day.